as we have examined this legislation and looked at its cost and its benefits and how that's distributed over time, it's become clear that what the other side has tried to do, what the Democrats have tried to do with this bill, is understate its true cost by front-loading the tax increases and back-loading the spending. In other words, the tax increases kick in right away when much of the benefit of the bill doesn't kick in for several years. And so I want to point out, just to illustrate what the senator from Texas has said, and that is the tax increases in the bill begin on January 1 of this year. So 21 days from now, Americans, individuals, families, small businesses are going to see taxes go up. Unfortunately, they aren't going to see any benefit come until 1,482 days later. Now, what that in effect does, it has understated the total cost of this legislation. They've tried to say we want to get this under $1 trillion. The President said I need a bill under $1 trillion. And so they try to come up with a bill that's about $1 trillion. But what they don't tell you is by delaying the benefits and front-loading the tax increases, that you are actually going to have a 4 or 5 year period there where people are having to experience tax increases, which is going to impact not only the small businesses, because you've got Medicare payroll tax increase, which, by the way, for the first time won't be used for Medicare, will be used to create a whole new entitlement program, health care program. You've got an employer mandate, which is going to hit small businesses. You've got the tax on medical device manufacturers, on prescription drugs, on health plans, all these taxes that kick in right away. And so what happens? These taxes get passed on to the consumers in this country in the form of higher premiums. So people are going to see their premiums go up. Small businesses are going to see their taxes go up immediately. Well, 21 days from now. But the Americans are not going to see any benefit from this for 1,482 days. So what we have is a gimmick that's been used to disguise the total cost of this bill, which we all know when fully implemented isn't $1 trillion, but $2.5 trillion. And so the senator from Texas and I have a motion, and believe supported by the senator from Wyoming who is here, that would delay the tax increases until such time as the benefits begin, so that we synchronize or align the taxes, the tax increases, and the fees to begin at the same time as the benefits do, so that we will reflect the true cost of this legislation to the American people and not unfairly begin punishing small businesses by raising their taxes before a single dollar of benefit is going to be distributed to the American people.
I would just ask the senator from South Dakota, because it is our amendment, the Hutchison-Thune amendment, and surely the American people who would look at this debate would say, we're missing something. This cannot be right.
Well,
we can't have taxes that are increasing our premiums, increasing our prescription drug costs, increasing our medical devices that we have to have for our health care for 4 years. Did he say that right? Did he say we would be paying those higher costs for 4 years before there is any option available to allow more people to have health care coverage?
Well, and I would say to my friend from Texas that it's kind of the same old Washington game, the same old Washington gimmick, the same old backroom deal that's been cut basically, that of course we've had no input into, and incidentally there is another now latest permutation of this discussion going on right now behind closed doors, which is the Medicare expansion, which is a subject for a whole nother day. But I think what the American people are looking at, they're looking at this and saying, how does this impact me? More than anything else, they're watching this big debate in Washington, D.C. and saying, how does it impact me? And I think what they're concluding is that 90% of the American public, according to the Congressional Budget Office, would see their premiums stay the same at best, or at worst go up. And when I say stay the same, that means double the rate of inflation annual increases in their health insurance premiums. So the best you can hope for, if you're an American today, is the status quo when it comes to your health insurance premiums. If you buy in the individual marketplace, your premiums are going to go up 10 to 13% above the annual double the rate of inflation increases that we're currently seeing. So that's what happens to the American public, the average person out there in terms of their health insurance premiums. If you're a small business, you're looking at tax increases. You're looking at a whole new raft of tax increases that you're going to end up having to pay, which is why all the small business organizations, the senator from Texas pointed out the letter from the National Federation of Independent Business, which says this is going to drive the cost of doing business up. This is going to increase the cost of health care, not lower it. What they want to see in reform, small businesses, who are the economic job in our economy, is they want to see health care reforms put in place that drive health care costs down. And we know from every estimate that's been done, the Congressional Budget Office, we have some data here now from the CMS actuary that just came out yesterday that says overall health expenditures are going to go up, health insurance premiums are going to go up, so small businesses are looking at higher taxes. If you're a senior citizen in America and you're one of the 11 million people that gets Medicare Advantage, your benefits are going to be cut. So you've got higher premiums, increased taxes on small business, Medicare cuts benefit cuts to senior citizens across this country and to providers. And if you're a young American, you're faced with a $2.5 trillion new entitlement program that you're going to have to pay for. That's what the American people, as they're observing this debate, can expect to come out of this if the bill that's been proposed by the majority is enacted. And that's why we're working so hard to defeat that and to put in place some common sense reforms that actually make sense to the American people. And I know that the senator from Wyoming, who is a physician, knows full well the impact of many of these policies from being on the front line. He's someone who has had to deliver health care services in a rural state, and so I'd ask him to give us his thoughts about what these tax increases and Medicare cuts are going to mean to health care delivery in places like Wyoming. If I might enter into discussion with the senator from Wyoming, because as he said, his state and my state are not unlike in terms of the composition of population. We have big geographies in Wyoming and South Dakota in the west, and a lot of rural health care delivery. And the primary job creator in places like Wyoming and South Dakota is small business. I mean, small businesses are the economic engine that creates jobs. And as the senator from Wyoming mentioned, according to many of the analyses that have been done of this legislation, it would be a job killer. Suggested by the National Federation of Independent Business that 1.6 million jobs would be lost. Now, what's ironic about that is I've heard our colleagues on the other side come down here repeatedly and say that this is going to create jobs, this is going to be good for the economy. If that's true, then why are all these business organizations coming out and saying it would increase the cost of doing business, it would increase health care costs? You have that now validated by the Congressional Budget Office, by the CMS chief actuary at Health and Human Services, saying overall health care costs under this legislation are going to go up, not down, both as a percentage of the gross domestic product and also for individuals who are going to see it in the form of higher health insurance premiums. So I would say to my friend from Wyoming, because he and I represent similar constituencies and the economies are similar, although we wish we had more oil and gas than in South Dakota along the lines of what they have in Wyoming too. But the small business sector is what creates jobs. And he mentioned National Federation of Independent Business. I want to mention one other letter that we received from an organization called the Small Business Coalition for Affordable Health Care. And in that they state that these reforms fall short of long-term meaningful relief for small business. Any potential savings from these reforms are more than outweighed by the new taxes, new mandates, and expensive new government programs included in the bill. And that's signed by 50 small business organizations, one of which, by the way, is the American Farm Bureau Association, which is a big presence in my state, represents a lot of farmers and ranchers, small business people. I'm sure represents a lot of members in the state of Wyoming as well as in the state of Texas. And I think that what they're saying is what all these business groups are saying. And that is, we don't find anything in this. I mean, there may be some good things in it, but we find the overall, the core elements of this bill to be a detriment to job creation, to kill jobs, and to drive up the cost of doing business in this country. And so it's hard for me to believe some of the statements that are made by the other side, and I assume they're making them with the greatest sincerity, but they're just factually wrong. If they weren't, you wouldn't have every business organization in this country coming out and saying, we are opposed to this because it's going to increase the cost of doing business, it's going to kill jobs, and it's going to increase the cost of health care. And so I would say to our colleague from Texas who's here that I suspect that she has a lot of small businesses in her state, not unlike Wyoming and South Dakota, who share that view. recent study that came out yesterday by the CMS chief actuary sheds a lot of additional light on what is a very bad proposal, a big government proposal that does create 70 new programs here in Washington, D.C., but does nothing to affect in a positive way the health care costs that most Americans are dealing with right now. And the actuary goes on to say that access to care problems are plausible and even probable under the Reid bill. So the issue that we've talked about in states like Wyoming and South Dakota, where people travel long distances to get access to health care, would be aggravated by this legislation because you would have more and more providers, hospitals, physicians, who currently don't take Medicaid patients. You expand Medicare, which is the latest proposal the Democrats have put forward. And you have, as a consequence of that, you get fewer and fewer hospitals, fewer and fewer physicians who are accepting Medicare patients because Medicare and Medicaid both under-reimburse, therefore creating a cost shift where the cost is shifted over to the private payers whose premiums continue to go up and up and up. And so that's why you see all these studies coming out saying premiums are going to go up, taxes are going to go up, and Medicare benefits are going to be cut, particularly for seniors who have Medicare Advantage. And at the end of the day, this ends up being a $2.5 trillion expansion of the government here in Washington, D.C. But to the point that the senator from Texas made, and I want to draw us back because I know we're running out of time, we want to vote. We want to vote on this motion. And we don't think that you ought to start taxing people in 21 days and not start delivering benefits for almost 1,500 days. And that's what our motion would do.
Time has
expired. Synchronize the tax increases with the benefits. Yeah, I yield the floor. I would say to my friend from Texas that we do want to get a vote. We want to get a vote on your and my amendment, on other amendments, and right now that's being prevented or blocked. We haven't had a vote now since Tuesday. We've got these amendments that are ready to go. The other side has said they're open to amendment and they want to get this bill moving forward, and yet we're being prevented from getting votes on amendments. And in the meantime, this backroom deal that's being cut, which we haven't seen, supposedly has been sent to the Congressional Budget Office to find out what it's going to cost. But we're sitting here waiting for that deal to emerge. But in the meantime, we're looking at a piece of legislation that costs $2.5 trillion when it's fully implemented, as the senator from Texas has said, relies on Medicare cuts and tax increases to finance it. But even just yesterday, the chief actuary at the Center for Medicare and Medicaid Services basically came out and said that the savings that are relied upon in terms of Medicare cuts are unlikely to be sustainable on a permanent basis. And so they raised the question about whether or not those cuts are actually going to occur, and if they do, whether they'll be sustained. And if they aren't, then you've got the question of whether or not a lot of these providers out there, if the cuts do occur, and they continue to lose more and more every time they see a Medicare patient, then they're going to start or quit participating in the Medicare program. You'll have fewer and fewer providers who are offering services, making more and more difficult for people in areas around the country, especially places like Wyoming and South Dakota, to get access to health care. So you're assuming all these savings or cuts in Medicare are going to occur, and of course you're assuming all these tax increases, and even with all that, you've got a $2.5 trillion expansion of the federal government, which inevitably, in my view, is going to rely more and more on borrowing. I think you're going to see more and more going on the debt. We're going to be passing it on to future generations because, as the CMS has pointed out, it's very unlikely that these Medicare payment cuts are going to be sustainable without driving hospitals and doctors and other health care providers out of business. And when they start reacting to this, and those Medicare cuts no longer are sustainable, then you've built in all this new spending, and there's no way to pay for it without raising taxes dramatically, which would be, I guess, something at the other side, since they've already demonstrated a significant willingness to raise taxes in this bill, or borrowing, neither of which is good for the future of this country or our economy. Right now, our economy is trying to come out of a recession. Small businesses, which create the jobs in our economy, are faced with higher taxes under this bill, which is why they've all come forward and said, every conceivable business organization saying this is going to drive up the cost of doing business, it's going to raise the cost of health care in this country. And so you have all these small businesses saying we aren't going to be able to create jobs, this is going to kill jobs. So you've got that specter out there to start with. And then you also have the idea of the Medicare cuts, which is, according to the CMS actuary, unlikely to be sustainable, leading to borrowing and debt, which means we're already running $1 trillion deficit every single year. We're piling more and more on our federal debt. There's going to be a movement here to raise the debt by almost $2 trillion. And so we pass this on to future generations. Future young Americans are going to bear the cost of this massive expansion of the federal government. So there isn't anything in this that's good for the American public, which is why they are reacting the way that they are and why you're seeing these 61% of Americans coming out in these polls against it.